You are listening to the Cultural Providers Network podcast, a Minnesota Association for Children's Mental Health production, building and sustaining a network of culturally and ethnically diverse voices to promote policies, practices, standards, and research that improve the mental health of children, their families, and communities.
This podcast is brought to you by the Minnesota Department of Health. Greetings, everyone, and welcome to the Cultural Providers Network podcast. I'm your host, Brandon Jones, and on today's episode, we have someone who not only kicks butt clinically, but also kicks butt in real life. I don't know the discipline of martial arts that he does, but I know he's good at it because he has a few different belts. Mr. Lambers Fisher, how are you doing today, Lambers?
I'm doing pretty good, sir. Thanks for the welcome. I appreciate it.
Awesome. It's a pleasure to have you on the podcast. This podcast is all about seeing the world of mental health, emotional well-being, therapy through the lenses, through the eyes, through the mouths of folks of color. And because we don't often hear about the therapeutic process or even this work from that perspective, especially if you're someone who has a degree, if you're someone who got licensed to be a mental health provider, if you're someone who's been in a psychology class, you don't see a lot of brown faces in those textbooks. So one of the things that we want to do with this podcast is give an opportunity to highlight those folks who do this work, and just to hear a different perspective on mental health. So can you tell us a little bit about who you are, what's your background, what's your origin story? Who's Lambers?
Who is Lambers? This is a great question. I appreciate it. Lambers Fisher is the name. I'm Junior, so at least there's two of us out there. We're still trying to figure out how far it goes beyond that. But I'm in the Twin Cities now, but I'm born and raised in Chicago, as they say. That's where my home is, where my family's from. My MFT origin story, my professional origin story, does kind of stem from being in Chicago. I go back to when my parents divorced as a kid. It's a very common experience, unfortunately, for kids to have to wrestle with what their family's going to look like in the future, different than what it looked like in the past. But what was not so common of a response was the fact that I then looked around to every relationship I could find, so I could find something else to model after. I said, okay, well, I want my family to last when I get there eventually. I want to be a husband. I want to be a father. I want to have a lasting relationship. But if home wasn't going to be where I had the model, the example, then I need to find as many couples as I could find, as many intact families that I could find. Didn't find nearly as many as I thought I would find, whether it be extended family or community. Found a few, and I grabbed on as much as I could. But eventually, I realized that there's this whole field called marriage and family therapy and the field of psychology that could teach me how to have a lasting relationship, have a lasting family unit, as it were. And as long as I, helped other people do the same thing along the way, then I could have a career and have a family too. And say, cool, sign me up. That's what got me in. And I've never looked back because I got enjoyment out of it. I got enjoyment out of seeing people have very little hope that their relationship could last, and to see that there's ways that they can get the very thing I was trying to get. And we're just past 21 years married, my wife and I. So I'm trying to hold it down, not taking a single day, month, or year for granted. Couples have lasted long and then called it quits. So I'm not taking it for granted at all. So I'm trying to practice what I preach, and that's what I've been doing, especially not only my family, my home, but also my community, all the people who I love, extended families, and people in my community in Chicago and Twin Cities. It's like people like me need families to stick together as well, and we're not getting a lot of help doing it. And so, as much as I can help, then I want to do my little part to have a big impact and prevent some of the same experiences I had as a kid in somebody else's home as well. So one day at a time. That's what I've been doing.
Awesome. That's amazing. Yeah, my similar to your background, when I entered into the clinical space, I entered as a marriage and family therapist because of the importance of family. And I realized early in my life, the folks who really struggled, they didn't have the best bonds with family members. A lot of times it was parents and caregivers. Or when things got tough in families that were around in my community, the relationship amongst their family members was strained. And I've seen how that ripple effect took place. It wasn't just the individuals, like everybody took a piece of that issue or problem that was showing up in dynamics. I know that's one of the key focuses when it comes to marriage and family therapy, just the field and understanding. Can you share a little bit more about how culture plays a role? Because everyone doesn't approach family the same. But how, from your perspective, how does culture show up um, when in these family dynamics and how we deal with some of the concerns and issues that happen?
Yeah, yeah, no, I've been grateful that over the years of me being a therapist for 20 years, I've gotten a chance to see a variety of different family styles, whether it be family styles in the sizes or the types of traditions they have, or types of practices, whether it be historical traditions from their cultural background they've had passed down for generations to generation, or just what any one particular couple's tradition in their home, or what we do for this holiday, or what we do for these types of things. It's like different ways of doing things. So I've gotten a chance to learn, particularly that there's a lot of differences. Then there's a lot of healthy ways to do things that are different. It's not who does it better and the other culture should try to do it that way. It's but no, it can be different and good for that family. And so I have found that culture plays a part in the sense that we all have the opportunity to find out what works for us. And the challenge is not what's good or versus not as a whole, but does it work for you in your household? Whether somebody looks like you or doesn't look like you, you can find a way to learn to appreciate what you have, appreciate what could be modified, but also appreciate, oh, we don't do it that way, but if that works for you, then go ahead and do it. And so it's challenged me as a therapist to say, okay, whether if somebody looks like me but they do some things the same. Okay, cool. They look like me and they do some things differently. Still cool. They don't look like me and we do things differently. Does it have to be a barrier? No. And say, oh, how can I learn about you and still be an asset to you? And say, how can I help you enhance your decision making process and express your culture in a way that's more consistent with you? And if it's different, this will be it. And so to find a way to acknowledge and respect varying cultural expressions, varying cultural values, while also appreciating my own. My appreciation of somebody else's value, cultural value, doesn't diminish my appreciation for my own. It almost enhances it. It's like, oh, just as much as I own mine and value it, I want to help somebody else be able to own theirs and value it and say, well, yeah, but we don't have the same faith belief. We don't have the same ethnic or racial kind of backgrounds and traditions. Like, no, we don't. But just as much as I like mine and don't want anybody trying to lower mine, belittle mine, or minimize, or maybe second guess mine, I want to offer that same value to you. You do you, I do me. And if we all give each other that space, then we can learn about and appreciate ourselves as well as everybody else in a very healthy way. And so I've learned to cultivate that in a way that is unfortunately not that common. A lot of times people don't go to therapy because they realize, well, or that they realize they fear that the therapist will be so different that they'll either force them to change things that they value or minimize and devalue things that they value. And oftentimes it's unfortunately been true. And sometimes it's been accidentally true. They weren't meaning to, but they accidentally did. And so that's why I try to, help out on both ends to help reduce that frequency. So yeah, it is a value because our culture matters a lot to us. Some a lot, some a little, but it still matters. And the more we therapeutically as professionals can give our clients that space to be them, the more powerful impact it can have.
Man, absolutely. That was a great answer. You actually answered like three of my follow-up questions too, which is amazing. Because
Awesome.
one of the things that I often run into is folks talk about representation mattering in the mental health
Yeah.
and making sure we have cultural providers that look like the clients that they serve. But let's be honest, just due to sheer numbers, that's not always possible. And if you
Agreed.
need help, if you need assistance, if you need to connect with someone, y- I always said go to who's available, especially if they have a specialization in what you're dealing with, and
Absolutely.
and attempt to get the help that you need, and don't just think that just because they don't have the same ethnic background as yourself or even socioeconomic background as yourself that they can't help you, because there's a notion of that this person will not understand me, and you said it. Well, these there have been incidents where that's shown up, even for myself as a therapist, that's shown up where I was working with the African American young men And I remember having supervision and my supervisor not understanding half of the stuff or a little
Yeah,
more than half of what we were talking about, what we were doing, why I was suggesting certain modalities and practices. And
gotcha.
she's like, You're gonna get this kid in a fight." I'm like, "No, this is like preventing him from fighting. Like this is helping
Exactly.
this young man, this young man from being aggressive because that was his main issue. As
There
he
you go.
needed a different outlet for that aggression. It wasn't just to suppress it for himself. So
Yeah.
it was interesting to try to do that. It was a level of code switching that I don't think often is talked about from mental health providers. That not only do providers of color have to code switch, white providers need to learn how to do that as well to connect with their clients as
Yes.
well. So it's a skill set more than a hindrance, I believe.
Agree, agree. And it has to be intentionally done. A lot of
Right.
times, a lot of professionals say, "Oh, I don't know how to do that innately," or "I don't
Yeah.
know how to do that because I wasn't taught to." It's like, yeah, you and a few other thousand professionals. That's not a barrier. That just means that's the next challenge for you to overcome. And if more and more people are willing to do that, the more impact we can have. Yeah.
Absolutely. Can you share a little bit more about how you integrate cultural sensitivity and awareness into your practice? Um, yeah, how does that show up how you work with your clients?
To a certain degree, cultural sensitivity, cultural awareness as a whole is just an acknowledgement that there's more to us than just one thing. One of my earlier understandings of the phrase intersectionality, what wasn't academic, it wasn't some just academic, fancy term. It was just the idea that when we talk about culture, a lot of times we default to race and ethnicity, which is one of the more significant ones in this country, how historically things have worked out. Totally understand that. But culturally, there's also gender, there's also socioeconomic status, there's also faith beliefs, political beliefs. We're more than just one thing. We can have many similarities and differences. And when I remind myself of that, then yeah, sure, race and ethnicity will be one of the main things people identify with, and they'll have significant influence over what their values are in so many different ways. But even though there might be differences between me and somebody else who might see as a client, a family, an individual, ethnically speaking, we might have similar gender or similar faith beliefs or similar political beliefs. I can find something to identify with, something to connect with, something to reassure a little bit more easily than others. And when I can find that, then whether I self-disclose that or not, I can use that as an opportunity to show empathy, to show understanding, to say, "Oh yeah, no, that's not the first time I've heard that." It can offer reassurance to the other person that says, okay, there may be some things that I may have to explain a little bit differently, but not everything. There may be some things that are either unique to my culture that my therapist doesn't know, or just unique to my household that my therapist wouldn't have a chance to know, but they don't have to explain everything because I can adapt. And even then, even if I do share something that's clearly different than my therapist, when I did, the therapist was more, me, being pleasantly surprised, more so than inconvenienced. I'm showing my sensitivity. A lot of times people think cultural sensitivity as if it's, they think of the sensitive word, sensitive, walking on eggshells, delicately balancing that minefield of offenses. And it's like, yes, that is a way of using it. Or I can be sensitive in the considerate sense. I'm considerate of that you may have needs that I don't have. You may have concerns that I don't have. I'm going to considerately determine what I do out of consideration for your hurts, your cautions, your fears, your vulnerabilities. Not here I go again, having to jump through hoops, change everything I'm comfortable with because you have had these bad experiences that I haven't had. It's like, no, you had experiences that I haven't had. It's the least I could do is to accommodate, to be considered. So if I consider that, then all those different ways. Have you had any gender experiences that I haven't had that I can be considerate of? Have you had any religious experiences that you have had, good or bad, that I can be considerate of? Political, it's like I can just go down the list. And so my whole effort then is to be culturally considerate, culturally aware of as many things as possible, some things preemptively, some things listening for as I go, and then accommodating the person I'm trying to make you feel comfortable so I can help them live a better life. And so it becomes less of a burden or hassle and more of an opportunity to say, what else can I learn about experiences outside of my own? Because every time I do so, professionally speaking, then that exposes me to another experience. So when another person says, you probably never heard, we're from different cultural backgrounds. You probably never heard of anything like this before. It's like, actually, that's not the first time I've heard of that before. And although their experiences may not have been exactly yours, I can imagine you might be feeling something like this? Is that close? It's like, oh, you clearly haven't had my experience, but you're not as useless as I feared you were before I came in. You might be able to understand the next thing I have to share. And it opens up the floodgates. And so we don't have to know everything. We can be considerate and learn as we go. It's a great opportunity and something like I look forward to every day.
Awesome. Awesome. Yeah, I think it's often overlooked the role that we play, professionals, in impacting how some of the social dynamics play out. But a lot of it is just being intuitive, listening to what your clients are saying, helping them kind of see things from different perspectives so that they can navigate the world as best as as best as possible. Can you share a little bit of your strategies or techniques to or no, let me ask a different question. Let me back up. What role do
Go for
you
it.
believe that mental health providers play in addressing some of the systemic issues, such as racism or discrimination, or even intergenerational trauma, when it comes to the clients that we see?
Yes, yes. I view the therapy role as a very integral one in society, even from a small one-on-one kind of basis. We have an ethical responsibility to advocate for our clients, but a lot of times people have a very narrow view of what that means. Get a authorization to release information to speak on behalf of our client for some specific need that they have. It's like, yes, that is a part of it, but I like to view advocacy in kind of a twofold way, whether it be external, outside the therapy room, and there's inside the therapy room advocacy. Outside of the therapy room, maybe you will actually try to speak up on behalf of somebody. If you have a client where you're not trying to enable them by doing everything for them, but you're trying to empower someone who can't say certain things, or reach out to a certain a resource to help them get a need met in a way that you have the unique wording to be able to say or do, or just represent. Sometimes there'll be ways to do things socially, lobbying for certain resources in the community. That's great. But a lot of times, people who are more familiar with the confidentiality of the therapy room are saying, I'm not trying to be out there in the public, do that social advocacy stuff. That's just not me. That's not my personality. That's not my professional role. That's blurring boundaries, and all that has merit too. And so for everybody in that camp, or everybody as a whole, when in that camp, part time or not, there's also the advocacy within the therapy room. A lot of times it's kind of overlooked. I like to view that as an opportunity to speak into certain issues one client at a time. It's not about an agenda. It's not about proclaiming a particular faith message or political message. But I like to view every law enforcement officer. I have the opportunity to serve as a therapist for whatever reason, family reason, personal reasons, professional, uh, and as I'm in my work to help them out, if I'm helping them broaden their perspective of experiences outside of their own, in my effort to help them, not for a particular agenda, but to see others' experiences of how they're interacting with others and how others are experiencing them, then in effect, I'm advocating for every person that law enforcement officer encounters in their daily efforts, because I'm helping them be seen for who they are as a person, less likely for biases to get in the way, less likely for preemptive fears to get in the way, because I'm helping them be a healthier person out in the environment. So I'm advocating for the community one officer at a time. Uh, every political official who I have the opportunity to serve in the same way, on a one-on-one basis, I'm helping them broaden their perspective of the experiences out and the needs outside of their own, the experiences outside of their own. I am advocating for every one of their constituents who in the community who they're serving, because that person will go into work considering the needs of more people outside of just their own. And I can do the same thing for teachers and healthcare professionals. We can advocate for healthier decision making. We talk about health disparities, legal disparities, law between court decisions, things like that. Every judge who I have an opportunity to serve as a therapist, I'm helping them be a wiser, more considerate person of needs outside of their own. And so we have an opportunity to plant seeds. Heck, even outside of particular professions, every parent who you have the opportunity to speak into and help their self-esteem and anxiety and depression, you're helping them be a better parent, having healthier dinner time conversations that are influencing the next generation, because they had parents who helped them see experiences outside of their own, consider others' needs. We can advocate for the community as a whole, whether we leave the therapy room or not. So we have an opportunity to speak healthy decision making, reduce biases, increase healthy perspectives on others, and even sometimes help encourage healthier advocacy in others who may be doing more than you in a different way. So we have a unique opportunity that I would say is like any other field. It's not better or worse; it's just different, and we can still have an impact in it.
Absolutely. And I think one of the things that has taken place since the pandemic is we have this huge influx of people who are like, hey, I'm willing to see a therapist. It's something that the therapy world has been waiting to happen. I don't think we were anticipating it was going to happen like this, but
Yeah,
it's shown up
yeah,
and it's here. And now the supply does not meet the demand, and we're kind of in this odd space of wait list and
yeah,
the over need of beds for people who are in crisis situations, and a lot of medications for folks who need the psychiatric level of care as well. So we're in this interesting space right now in the mental health world, and part of me feels like there needs to be some innovation and a turn to help curve this demand. And what I mean by that is that we're not going to be able to get every person who's seeking that help right now in front of a mental health provider. So we're gonna have to have some sort of collaborative approach. I don't know if it's with healthcare, education, maybe public health, maybe even government in the mental health world to help society kind of deal with our well-being a little bit better. And one of the things that I'm thinking more about is how do we help create more of a message or a strategy around well being where people can take some of the therapeutic skills that we teach and implement them in their lives on a daily basis so they don't have to be dependent or waiting for a mental health professional. What are some of the things that you kind of coach or teach or assist your clients with to help them maintain what they're learning in session in between sessions? What are some of the
yeah.
things that you use to help people implement the therapeutic approaches on their own?
Yeah, yeah, no, I'm a very big fan of that perspective of not thinking that therapy is the only way of doing things. Yeah, great. Yes, I'm a fan, but we are limited. Not everybody's going to do it, and so I have my own strategies for trying to maximize what is available. But also encourage people to do as much as they can outside as well. And so recognizing that people are busy. There's limited opportunities. It's like, okay, so do this big course, do this big life-changing event, commit 5 hours a day to your well-being. It's not going to happen. We have enough things to stress about. That's why we need therapy in the first place. Not because people are just so much worse than we were before. So no, the people are people. Life is a lot more to deal with. There's a lot more stressors to be stressed about. Not more to be anxious about. It's totally legitimate. And so we need to help out. And so, as a whole, in the absence of a whole lot of established resources, a couple of things that I do kind of focus on. Some for those who already have faith beliefs or faith community as a whole, I do encourage them to maximize that. It's one of the few things that are established outside of work and home. Various faith communities, big or small, is often a good place to start. If they have one that they're already aligned with or are interested in, and then encouraging them to make the most of whether it be classes or groups or just even activities to be involved in. That's a good place to start to build that connection, build connections for reinforcement, encouragement, places to not be your best and feel acceptance. So I start there. But even outside of this faith communities, there are other ways in which you can build community. You can start with neighbors, which we have very decreased interactions with compared to 10, 20, 30 years ago. Meet your neighbors so they're not just people who you kind of nod at passively as you drive by, but you actually interact with for those few minutes, and they can become people who you can confide in, even if you're just going out to get the trash at the same time. You can actually stop and have a conversation and find it a lot more fulfilling than you used to, than you expected, or get involved with activities, meetup groups for sports or at the Y or things like that. Those interactions can be very impactful. Sometimes people go when they don't feel like it. They're tired. They don't feel like exercising. They don't feel like playing the pickup game of basketball, but they go for the interaction. They go for the camaraderie, and those things matter. Also, actual groups, support groups. It may not be therapeutic; it could just be actual, just meetup groups or things like that. There's a lot of things you can do. It's just a matter of finding them to try to either create them or find something that's close and it's worth driving for. It's worth having those interactions. But despite, not despite, in the midst of any of those suggestions, whether it be formal or informal, I encourage my clients to be contagious in that social way. Don't just broadcast what you're doing, narrate what you're doing. Yeah, I don't really interact with my neighbors too much, but I thought I'd say hi this time. I don't really use you, but you know what? I kind of felt tired, guys. But you know what? You guys, don't irritate me that much. I actually like hanging out with you guys. Like make it fun, make it humorous, but invite other people to say, you know what? I like you too. You know what? I like having fun with you. Just like invite the transparency because that can be the starting point. Be contagious. Encourage other people to, if you're tired, still come. We missed you last time. I was tired. I didn't have much time. Well, hey, come anyway. Even if you just sit off to the side, we like having you here. Narrate, make it obvious because you might be pleasantly surprised how many other people will say, you know what, that's why I come to. I actually appreciate that too. Maybe you can make more of that. We need to build more casual interactions, more social interactions, more things that invest in ourselves socially, because our well-being makes a difference. When we have people we can confide in when things get difficult, when we stress about, say, hey, before you pack up and go after this pickup game or this little meetup or whatever, can I bounce this off you real quick? Not that you have to be a therapist, just am I losing my mind here? Does this make sense to anybody but me? And just to hear that validation can go a long way. And if you need something a little bit more structured, a little bit more kind of support for that, then yes, find one of the small percentage of therapists available out there. But you can have a starting point, and we can offer that kind of benefit as well.
Awesome. Those are all great tips. A few more questions for you.
Let's do
Um,
it.
the next one I have for you is, what advice would you offer a BIPOC individual, so a person of color, who may be hesitant to seek out therapy or face barriers accessing mental health support?
I'd say to someone cautious of accessing mental health support, assess your need. And what I mean by that is that if I'm hungry and I'm slightly hungry, then I can be a little bit selective about where I get fed. If I'm starving, I'm gonna take the next available thing and I'm gonna make the most of what I got. And so, if you have a little hunger, you have a little need, you could use a little bit of support, then be patient. Try to find the right fit. And to a certain degree, I support therapists hopping initially to say, hey, we're not a good fit. A session or two in, I don't want to waste your time. Don't waste mine. I hope you're not offended, but I don't want to go too far into this if it's not going to be a good fit. And if it's a good fit, that's fine. But be selective if you have the space to be. And if there's an intense need that you have, be willing to see who's available. There's no perfect therapist. No matter how many similarities you have in common, there's no perfect therapist. They're not going to know your exact personal history. They're not going to know your exact present, everything you have. But whoever you have available to you, recognize that they have some strengths and they have some growth areas. There's going to be some things that they understand because they should. That's what the job is. There's going to be some things they understand that you can be pleasantly surprised about. Like, oh, I didn't think you could understand that part. And there's going to be some things that they don't understand. But if they're trying to be the best professional they can be, they'll be open to learning. They'll be open to hearing. Not that you have to be a tutor and teach them everything about you in order to get help. No, that's not your responsibility. But they can learn along the way. And the best professionals out there know what they know and they own what they don't. And they try to balance that and learn along the way. And if you can find someone who's open to doing that, then you can go in with the appropriate amount of caution, the appropriate amount of vulnerability, the appropriate amount of trust, and increase your trust. You don't have to go and spill everything out. Maybe you had a past experience that didn't go well. Maybe you had caution about the whole field. Maybe there are differences. I haven't had caution with the field, just with, you know what? The last person I interacted with who looked like you did this. So I'm going to start off with a very minimal level of caution, of vulnerability, minimal level of trust, minimal level of benefit of the doubt. But as you show me that you can be trusted, I'll slowly increase that. If you're a professional, worth your salt, then you will understand and support my growing level of trust and be patient with it instead of judging it as beginning at the very beginning. And if they're willing to earn it, then I encourage you to be open to letting them grow in that trust to the degree that they've earned it. And you might be pleasantly surprised at at the benefit they can have to you as you are not teaching you about who you are, not teaching you about your culture, but by coming alongside of who you are, your identity development, and your cultural expression, and to give you some tips and strategies. Say, okay, cool. I'll take those tips and strategies. Now I'm gonna go be me in ways that you have no clue about how to do. But thanks for giving me those insights. Take what you need, leave the rest, and go be you.
Absolutely. I appreciate that. I think that is going to be very useful for so many folks who are listening. All right. I
Awesome.
want to, before we, two more questions before we close out. I want to hear your future outlook a little bit.
All right.
What changes or improvements would you like to see in the mental health field to better support clients of color? Well, let's say let's do one clients of color and then also the professionals. So, what things would you think are necessary improvements that you think we could have to help support the folks that we serve as clients and the folks who are doing the work?
So, in order to change the field as a whole, I can see a long-term plan being very beneficial. In particular, increasing the amount of diversity within the mental health field. There's no reason that therapists of color should be, under 10% of the field as a whole, not even just one ethnicity. Considering how many competent individuals out there who could be offering insights and wisdom to others in need. But what that would take is not some overnight website or online campaign. What that takes is planting seeds to younger generations to say this is a viable career that can not only be financially beneficial to say you can sustain yourself and your family, but this is a way in which you can impact your community in ways that aren't talked about very commonly. You can increase your personal community. You can have an impact far and wide. This could be something we need to attract more diversity into the field, not just for numbers' sake, for statistics' sake, but because the more professionals of color, of different genders, of different religious beliefs, or different political beliefs, like culture outside of just that, more diversity of professionals we have, the more research will be effective, the more theoretical orientations can be applied differently, the more treatment strategies we can come up with, the more interventions we'll have, and the whole field will be benefited from increased diverse perspectives and experiences, helping to meet uh, more diverse needs in a healthy way. So I think the more we can have a long-term plan to attract more professionals of color, or various cultural expressions outside of that would be benefited. But also on the second hand, the professionals in the field, we just make sure we're doing our best to appreciate the variety and the diversity that's already there without being an extra burden. I think I did an article a while ago on how to ask questions. The to ask or not to ask. It's like, well, you can't just say, "Oh, we have somebody who's different in our office. Let's make them responsible for every type of difference possible. Burden them with having to do everything for anybody who's different. Send it to them, and then you have any questions, send it to them. It's like, don't overextend the ones you have, but also appreciate the different perspectives that you do have. Sometimes people, professionals, diverse professionals in various ways, feel like they're in that token category where, okay, you're here, but don't expect to change anything. Not because change is the goal, but don't expect your voice to matter just like anybody else. No, we're asking for opinions, but not that minority opinion, not that limited opinion. I'm not even talking about like ethnic minority, not that small percentage. We have the LGBTQ person. We don't want to know about you exceptions. We have the one male amongst all females, or one females amongst all males. We don't want to hear these exceptions. Like, no, let's make sure every voice is heard within the professional environment. Let's make sure every great idea is heard. Let's make sure every complaint or caution is heard. Let's make sure everybody's voice is welcome because the whole field is benefited. Because not only do we get more variety in the professions, but you can have a more effective balance of support groups that you offer when you have multiple perspectives amongst the professionals, acknowledging different needs that aren't being met. And say, oh, why aren't our groups filling? Well, if you had a group about this, you could fill it. We never thought about that. I know, because you don't have that need. And so if we appreciate the ones that we have, then we can meet a greater variety of needs in the community with what we have now, while also getting more variety in the profession over a long time. So we have a short term and a long term opportunity.
Awesome. That's amazing. All right, that's pretty much it for our podcast. Can you just share with folks where they can connect with you? Maybe they can get your book or any other things that events, any other things that you may have going on. How can folks find you?
Well, in addition to not only just being a therapist, what I also do is try to help increase the cultural competency of the professionals that are out there now, and to say, okay, well, what if I'm not one of the 10% or so of diverse in that kind of way, therapists of color? What if I want to be more culturally considerate, but not be scared and culturally sensitive? What if I want to be more helpful and not unintentionally offend the clients that I see? So when I'm not in the therapy room, in this room right here. Well, this is not a fake background. This is my couch. We actually do some good stuff. When I'm not here seeing clients, I'm actually doing diversity trainings from a positive and encouraging perspective. A lot of times people hear diversity training and they think of that mandated, angry, offense-filled, everything you're supposed to do but not doing, everything that you're supposed to think but not thinking type of training. So I think I bring a positive, encouraging, relationship-focused training to the professionals that are already there. And so when I'm not doing that, I'm doing therapy. So when people need to find me either for therapy or for that, they can find me on my website. If you find me for therapists, think of my name, lambersfisher.com. Again, nobody knows what Lambers is, so you're definitely going to find me. Or people looking for my trainings to say, hey, maybe I'm not a decision maker, but my boss needs to hear this. We could definitely benefit from a training like that. Then it's the same website, but then I also just send them to diversitymadesimple.com, because that's what I'm trying to do. I'm trying to destigmatize diversity. And so I have the various trainings of various length. I have online courses they can find. But if you go to diversitymadesimple.com, then you can find all my different resources, or just contact me and say, hey, I need something unique like this. Is that something you offer? And I try to customize whatever I have to whatever the need be. And I also have a link to my podcast as well, my Diversity Dude podcast, because if I'm not being a therapist and I can't be that to you, and if I'm not coming to your organization, whether it be schools, corporate companies, nonprofits, mental health or not, doing trainings, then I do a weekly podcast just to offer general encouragement, positive tips, unique perspectives on some of the deep and sensitive topics. You got and that information is on my website too. So diversitymadesimple.com, people can find. And for those who aren't doing that, but just want a little light reading on the commute, I turned one of my longest trainings into a book. It's called Diversity in Clinical Practice. And that's available at Amazon, but also on my website as well. That offers a lot of those key tips and practical strategies to say, how can I either increase my cultural awareness or be contagious in that healthy, positive way in my environment. So podcast, book, training. I try to meet everybody's learning style in whatever way that I can. And so people can check out diversitymadesimple.com and find out whatever they need and reach out to me as well.
Amazing. And we'll have all that linked down below in the show notes. So people go ahead and check out those links. Lambers, it was amazing, man. We love talking to you. You're definitely an asset to our community. Keep doing the great work you're doing. And maybe we'll have you on the podcast again in the future.
My pleasure. Thanks for the invite. Happy to help. I look forward to it.
Awesome. Thank you. Take care, everybody.